And with that, I think I'm going to lead us into like a more general question about, what are the best practices in AI innovation and implementation? And to kick things off, I'm going to start with my sweet spot, like what are our ethical considerations and health equity best practices, and why does this matter? So AI is not going to replace clinicians, but it will advance caregiving capabilities. Clinicians must increasingly rely on human skills, such as empathy and culturally relevant care. So, for example, we have to train our providers in all different modalities, MDs, nurses, all caregivers, in meeting patients where they are. This real world data feeds the algorithms that AI will influence and ultimately use to improve care and efficiencies. So, for example, in marginalized populations, we have to do a better job of understanding the factors and interventions that will close gaps in healthcare disparities. Another example is trauma-informed care, unique ways to speak with and treat patients for people who have lived through gender-based violence or other forms of violence. And there are, some really interesting discussions going on in all over the country on how to carry out this care. So we all must kind of sit up and ensure that we're paying attention. These intentional practices will definitely influence health equity as AI technology advances. Otherwise, we're at risk of leaving the same communities who have historically been underserved behind again and again. And if AI is viewed as critical to healthcare's future, then a diverse group of stakeholders must be engaged in the dialogue. So a group like ours, right? Data scientists and engineers, but also clinicians, patient advocates, ethicists, economists, and policymakers. We have to all come together and have honest and wider discussions around how to implement ethical and equitable AI. Craig, I'm going to turn it back over to you in terms of legal considerations and why it matters in terms of risk avoidance, management, aversion, and other thoughts that I know you have. So I'm going to turn it over to you.
All right. So AI and machine learning is evolving so quickly, and as everyone should know, is the legal field and the resulting legal decisions and lawsuits, they're so slow. So this is a very new topic that we as attorneys are trying to figure out how to speed our pace of evaluation and bringing these to light to expedite these type of decisions. The key here in understanding the AI and machine learning legal perspectives is understanding where and how the protected and confidential information and or the data is stored, utilized, integrated into local or hosted external systems or platforms. In the law, most usually confidential or protected information is just that until it's not. And where you get to it's not is voluntary disclosure, negligent disclosure, or an authorization by an agent or principal of a business or him or herself donating or allowing this information to be imported into an AI or ML system. So that brings us into this confidentiality and these trade secrets. So, and I'm using this generically, meaning any confidential protected information to include protected health information under the U.S. Code states that an owner of a trade secret must take reasonable steps and measures to keep such information secret. Well, what does that mean? That just means that you can't go out and claim you have a trade secret or protected or confidential information and then put it on a billboard somewhere. That's the historical viewpoint. But however, we're not in the 1950s. We're not in Cleaverville anymore. This is, not 2023, where everything happens over a computer. Information is stored everywhere. And what happens when an employee or an agent of this information, a steward or a custodian of a company or an individual, just happens to link an information source or a depository containing this trade secret or protected health information or any other confidential information to, and it doesn't even have to be intentionally, it could be unintentionally, be negligently, links this information or this platform to an AI or machine learning system. Well, the AI and the machine learning system, typically when you feed information into it, it doesn't really care where the information comes from. It's utilizing it. And once those processes become active, there's no going back. So once the trade secret is input into this AI and machine learning system, more than likely your trade secret is considered public domain. Anyone can use it for any reason at all. There's about 4 or 5 big ticket lawsuits going on right now around the United States, and tentative, if you read the initial briefs and initial decisions, they're pretty much in lockstep with each other, that the courts are saying, hey, you gave it up. You fed this into and made it part of the public domain. You've lost any protection that the courts can give you. So that leads us into the patient and the data privacy. So everyone knows how important the protected health information, or PHI, is from a patient's healthcare and societal positions. However, one problem immediately arises when the AI systems become aware of this data, as I just brought to light. How does the AI system know that this information is still confidential? And how does it know that some of this information that was confidential hasn't been made unconfidential or public by a release or by a court order? It doesn't. So this is why the importance of safeguarding information from an AI or machine learning environment is so critical. Another issue that I sort of want to bring to light is the facial recognition technology that may be hijacked for improper, immoral, or unethical purposes. And first thing that came to my mind is it's akin to the past concerns of DNA information and the sharing of the same on Ancestry.com, 23andMe, because of the notion that this information really is the last line that police agencies can utilize to find and crack cold cases, this, that, and other. Ultimately, that the jury's still out on how to utilize this information, this DNA information, how it is being utilized after being deposited on a third-party site. And I mentioned earlier about the bad actors, the poison pills. There are some participants in the space now that are attempting to mask or thwart AI machine learning's ability to learn, to do just that. And specifically, I've been reading and studying the Glaze and the Nightshade programs, as I said before, from the University of Chicago. The baseline notion here are these artists that are seeking protection of their work, their artistic and music and things like that. They shouldn't have their work stolen, which is serious and valid concern. I think we can all agree on that. But AI doesn't seem to steal this information. They're just utilizing it to learn for future endeavors. And my initial observation on this position by the artists utilizing Glaze and Nightshade is, did they or did they not go to art school? Did they or they not learn from Van Gogh and Renoir? Weren't they influenced by those artists? I doubt that they gave credit or anything to those artists, but they learned from them. They created their own style. They didn't steal it. They just were influenced by their artwork. So it seems like, to me, the artists utilizing these two programs sort of want their cake and eat it too.